Hi, you join me now 3 days after surgery. It's Friday the 3rd of March. I had the surgery on February the 28th. As you can see here, there is some swelling around here where the gland has been placed. I got a black eye, which I wasn't expecting, but there is some trauma around here, so I suppose that's to be imagined. And as you can see, I've also got a wound here where the gland was removed and placed here. So for the first few days, I was fairly immobile. I had drains coming out of this wound and a drain coming out of this wound with pots of blood. Not great. But you get through it. It's difficult as well being here on my own without my family, and we're not, I won't be discharged now until I think Thursday. The stitches are coming out, which will be, I can't think what the date will be, the 9th of March. It's hard work being here on your own and being English and with the language barrier, but everyone's great. I've managed to get some fresh air yesterday afternoon when the drains came out, and this morning, and had a coffee in the coffee shop. So all things are good, and just this morning my eye is now watering. So the gland is now starting to produce moisture, which I'm told, the professor tells me that there are two phases to this. The first phase is parasitic secretion, which is where the gland, after the gland is first initially placed, you get moisture coming into the eye, and then that backs off and the eye goes dry again, and then the more regular secretion comes in. But what I have discovered is, because I was in two minds whether I was going to come here. I have both my punctures cauterized to help with my condition. Now I didn't know whether to have them cleared before I came here, or that would cause more problems. I wish I had now, to be honest. So one of my first tasks when all the bruising's gone down and I'm back in the UK will be speak to my English doctor I've already spoke to before we came out here, and he will reinstate my punctures, uncauterize them effectively, and put that natural flow back into the drainage, back into the eye. So there'll be fluid coming through across the eye, blinking and being pushed to the right and down the tear ducts, the punctums at the top and the bottom, and down through my nose. It's looking positive. I won't lie to you. It was a bit of a shock this morning when the moisture kicked in and I actually have a runny eye, because yesterday I was panicking that nothing was happening, and we were 2 days after surgery. So it's all suddenly just started happening. I'll catch up with you. I don't know what the plan is now. Like I say, I'm being discharged on Thursday next week. My flight to the UK is Saturday, so I'll be staying over in Lubeck on Friday night. But I will probably catch up with you sometime next week and let you know how things have gone, and hopefully some of this should have started healing and you can see an improvement. I'll catch you later, guys. Thank you for being with me on this journey.